Hello, welcome to this week's episode of Health Watch on Anglican Cable Network Nigeria. I am Angela Mweze. In the world today, the desire of every couple is to become parent within the first or second year of married life. While many couples have this dream fulfilled, there are quite a number of others who do not, no matter how hard they try. Infertility has recently been construed to be a serious problem in sub-Saharan Africa. According to experts, the prevalence of infertility in Nigeria is put at between 20 and 25% among married couples. It has also been discovered that 40 to 45% of all consultations in gynecological clinics are infertility related. As growing incidences of infertility in the country continues to stare victims of this plague in the face, it is fast becoming one of the main causes of stress between couples and a huge source of depression for women. Today on the program, we shall be discussing infertility, and my guest is Dr. Uduak Samuel. He's a gynecologist at the National Hospital, Abuja, Nigeria. Okay, you're welcome to the program, sir.
Thank you very much.
And it's good to have you.
Glad to be here.
All right. So from what we were just, from the introduction we had, it says 40 to 45% of all consultations in gynecological clinics are infertility related. Is that your experience?
Yes, infertility is a very common problem in Nigeria, but many people wonder what infertility really is. I think we should start from the beginning. Infertility is inability of a couple to achieve pregnancy after 1 year of regular, unprotected sexual intercourse.
Okay.
Regular means at least 3 times a year. So if a couple has been living together, having intercourse for at least 3 times in a year without the use of any contraceptive or protection, and they are not able to achieve pregnancy, that condition is called infertility.
Okay.
And it is important to discuss this problem here and now because a lot of people don't know what to do. And because of ignorance, many people have stayed at home doing nothing or visiting places where they cannot get help after 1 year, hoping that they will get pregnant. And at the end of the day, they don't, or they've wasted their reproductive years only to show up in the hospital when it is really late for anything to be done to help them.
Okay.
And we always encourage couples. If a couple has been married for 1 year and they have tried and they are not able to achieve pregnancy, they should get medical help.
Okay, that's having constant sexual intercourse at least 3 times a week.
I said regular.
Regular.
Yes.
Okay.
And it is important also to say that while we're not trying to draw a timetable for couples or tell them when, it is important for couples to interact sexually regularly. This is important, or this will be important to couples who live apart. There are some people that get married, the husband lives in Abuja, the wife works in Lagos, and they only meet when the wife is ovulating during the ovulation period. It doesn't work like that.
Yeah. Because
it will be very difficult for the woman to say that today is my ovulation period. So we meet. So for that reason, because it is very difficult for somebody to say today is my ovulation period, so we encourage couples to meet as regularly as possible.
Okay. So you can't be living apart for you meet only over the weekend or when you have your ovulation, then you come in and you say that, oh, we're having problem with infertility. It has to be you being together.
Yes, regularly. So we encourage couples that want to have children to live together as much as possible, meet as much as possible. It improves their chances.
Okay, so just from your experience, what's it like? Is it more the issues of infertility? Because of course it's either from the man or from the woman, but we'll discuss that as we go on. But with your experience, what sex come up with the issue most? Male, female, or it just doesn't have?
No, there's a misconception that infertility is a woman's problem.
Yeah, because that's the general thing. If there's no child,
Yes.
the woman is responsible.
Yes, and that is why it is very common for you to see a man sit at home, send his wife to go to hospital and find out why she has not been able to conceive. But statistics has shown that in 30% of cases is a woman that has a problem.
Okay.
In another 30% is the woman that has the problem.
The man that has the problem.
Or the man that has the problem.
Yeah. Okay.
In the other 30% is both the man and the woman that has the problem. And
So
in
it balances then.
Yes, and the last 10% is what is classified as unexplained infertility. So you can see that the problem is as much of the man as of the woman.
Okay.
So the man and the woman contributes equally. That's number one. Number two, if a man is okay and the woman is not, pregnancy will not occur.
Okay.
If the woman is okay and the man has a problem, pregnancy will not occur. So it takes two normal people, so to say, for pregnancy to occur.
Okay, so the information we're driving from these statistics now is that the error of blaming the woman is, should I say, no, the error of assuming that the woman is the one with the fault is gone now.
It's gone.
It's a balanced thing. So it's either from the man, it's from the woman.
What we are saying that is a man's problem as much as it is the woman's problem.
Excellent. So I'm sure our viewers has gotten that clear now, so that nobody's blaming one person or the other. But is it possible, let me start with that question before we go into the causes of this. Is it possible for somebody to be born infertile? Say you were born.
Yes,
and
it's possible. And we are going to talk about that when we are discussing the causes.
Okay.
But let me also say this. It's the incidence of infertility, as you've said in your introduction, is increasing now than it was compared to what it was some 20, 30 years ago, for many reasons.
Okay.
Some reasons that have been found includes increasing problem of pelvic infection.
Okay.
More women are having pelvic infection, or what they call pelvic inflammatory disease, than before, because of women have become more liberal in terms of sexual interaction. Okay, so
pelvic inflammatory diseases are diseases that, I don't know if you can explain a little bit more on maybe examples.
While not trying to be too technical here.
Okay.
If a woman acquires infection that affects the pelvic organs, that infection can damage the organs. Reproductive organs, especially the fallopian tubes.
Like sexually transmitted disease.
Sexually transmitted disease, and that can render the woman infertile. And because of more liberal attitude these days to sexual intercourse, more women are getting sexually transmitted infection. So with the increased incidence of sexually transmitted infection, increase in blockage of the tubes, the incidence of infertility is increasing. Again, fertility has a lot to do with age. It's age dependent, especially in the woman. Now, women will focus on education first, and then career next, before now starting to plan on how to settle down and start having children. So they virtually spend their reproductive years pursuing education, pursuing career, and we know that the most fertile years in the life of a woman is the early years. Say from 18 years, they peak at about 25 years, and from 35 years, there is a sharp decline in the chances of the woman to getting pregnant. And you will agree with me that now women spend those early years trying to acquire education, trying to build a career, and start thinking about getting married or settling down at the age of 35 and above.
So which would,
and at this point, their chances of getting pregnant is significantly reduced. So because if you put all those factors together, you'll agree with me that infertility is on the rise.
On the rise. Okay, so basically the things that are responsible now for this rise in infertility is women. But that one, maybe women have a bit of, but the men, do their infertility increase with as they advance in age, or even if you're 90, you still are very capable of getting a woman pregnant anytime?
Women have a biological clock. That's the difference.
All right.
The day they born, the clock starts ticking. Yes.
Okay.
Men are luckier because even at an advanced age, they are still capable of getting a woman pregnant. But when a woman gets to about 40 years or 45 years, menopause is approaching. And menopause simply means her reproductive system is literally shutting down.
Okay.
So men are luckier.
All right, in that area. Okay, now let's go over to the causes of infertility, but I'll start with the men. What are the things that cause, or when do you say a man is infertile? Is it just when he cannot father a child, or but there are issues that you have to look around to say this man is infertile, he can't get a woman pregnant?
You say a man is infertile when he cannot cause his wife to get pregnant.
Okay.
Through natural means.
Okay.
The causes of infertility in a man, plenty. Let's start from your question that you have asked earlier. Can somebody be born infertile? Some people are born without a complete reproductive system.
Okay.
Both for man and the woman. So a boy can be born without a testis.
Okay.
And even those that are born with testes, the testes can be hidden. Can be, because the testes actually developed in the tummy and descend to the scrotum. That process of descent can be arrested. So the testis is arrested and is stocked somewhere in the abdomen in a process, in a condition that we call undescended testis.
Okay.
That testis that is trapped will become damaged because the environment in which it stays is not what it should be. So that damage can cause the baby or a man when he grows up to be infertile. And that is why it is important for mothers especially to check their children, their male child.
Okay. From
time to time, examine their scrotum to see if the two testes are actually there.
Around what age do they start checking this? Is it as soon as they're born, or?
The testes descends just before the child is born.
Okay.
So immediately after birth, for children that are born in the hospital, the babies are examined, and the examination will include checking the scrotum. But from my experience, we've discovered that many cases of undescended testes are actually diagnosed when the man has grown up. They have missed it all the while because nobody has checked. And even the boy child has not checked. Now that is one problem. So
it's important for every mother, when you have especially the male child.
It's not just the male, both for the male and
the female.
The female have their own issues to check.
Okay.
Check your child.
Okay. All right.
Now in the childhood again, there's what is called mumps. We know what mumps is. It's one disease that's a viral disease that used to affect the children's neck. Will appear as swellings on their neck. The same virus, yes, can cause problems in the testes of the child that will eventually result in that child's inability to impregnate a woman when he grows up. So it can damage, the same virus can damage the testes in a condition that is called mumps orchitis. So
as simple as it looks, having mumps is actually a very serious thing to consider.
It goes beyond just the swelling in the neck.
Okay.
Then a child can fall, especially if he falls astride a hard object or fall astride and hit his scrotum. That fall can damage the testes and make it impossible for that child to be fertile. If you will allow me. We could also have, as the child grows up, surgical operations such as hernia surgery. I'm sure you know what hernia surgery is. Yes, repair of hernia, especially what they call it inguinal hernia.
Okay.
The tubes that transport sperms from where they are produced to where they are released. Passes through the same almost the same channel where the hernia occur, and in the process of operating, that those channels can be either cut or tied in the process of surgery, and when that happens on both sides, it can result in infertility.
Wow.
Again, occupational work that men do, if the testis is exposed to very hot environments,
okay,
like people that work in local bakeries where they put fire, or in mines, environments that are very hot, or long distance drivers, people that drive long trucks from one end of Nigeria to the other, they sit permanently on a leather seat that is hot, and that hits continuously.
After a long
affecting
time.
the pelvis, yes, after a long time can cause damage to the testes that can actually make them infertile.
Okay, just so on that thought, what of the issue of, I think I read somewhere about computers, people that put computers on their lap. I don't know how established that research is, that people who put computers, men who put computers on their lap all the time because of the heat coming from the computer could cause damage.
Yes, if the computer is very hot, because I know there are some laptops that when you plug them for some time, they become hot. If you put them on your leg, if a man puts it on his leg for a long time, and the thing is hot, it can cause damage.
Okay. Now, there's so many things that cause infertility in men, but majority of them, just like if I can put a kind of a summary of what you said, most of the time come from childhood. You know, it should be monitored. Yes. And what of sexually transmitted diseases for men? Yes,
sexually transmitted disease.
You know, in men,
it's important in men as in women.
Okay, in terms of causing infertility,
yes, it
not
can.
Properly treated.
Yes, it can.
What
it can, even though it is much more important in women, but long-standing sexually transmitted diseases that are not properly treated in men over time can cause infertility.
Okay, when we come back from the break, we'll talk more on the sexually transmitted diseases that can cause infertility in men. We'll be right back.
Seven warning signs of infertility in women. We discuss the 7 major signs which are a definite indicator of infertility in women. 1. You have always had irregular periods. Now, do not make peace with this sort of a situation. If your periods do not follow the stipulated 21 or 35-day cycle, you need to be wary. Because, if nothing else, irregular periods indicate that you are not ovulating every month. This is among the sure-shot signs of infertility in women, though such a condition can be treated, provided you raise the alarm earlier on. You need to ovulate regularly to get pregnant. Statistics show that irregular ovulation is the primary cause of female infertility. There are treatments to cure this condition, and if you intend to get pregnant in the future, initiate now. 2. Your periods have suddenly stopped. Now, if you are not a menopausal woman and also not under any medication to delay or temporarily stop your periods, be very concerned. Your periods in such a situation shouldn't naturally stop, for stopped periods mean no ovulation, and if you are not going to ovulate, you shall not get pregnant. Ovulation is crucial to pregnancy, and halted periods is among the clear signs of infertility in women. Immediately consult your gynecologist and start on the requisite medication. Of course, there is treatment for stopped periods. 3. Your periods are very heavy. The flow of the vaginal blood should be moderate. Anything above that, which normally keeps you in bed, is a cause of concern. Heavy periods are an indicator of no ovulation, because the release of the egg from the ovaries triggers the production of the hormone progesterone, which is responsible for giving you healthy periods. Now, when you don't ovulate, the lack of this progesterone leads to extremely heavy menstrual Blood flow. This is a definite hindrance in your pregnancy plans. Notice this trend in your periods for a few months, and if they are consistently heavy, you need to see your doctor at once. 4. Pain during sex. Either your periods are very painful, or you experience pain every time you have an intercourse. These can be veritable signs of infertility in women. Have you noticed blood in your urine, or you have terrible rectal pain? All these are conditions of endometriosis. Stats show that about 7 billion women in the USA suffer from this condition, and of them about 40% turn out to be infertile because you have an extremely difficult time trying to get pregnant. Endometriosis can be treated, and hence observe your body. And don't feel shy to talk to your doctor. 5. Growth of unwanted, dark hair on your face. If you notice a sprouting of thick, coarse body hair on odd parts of your body, this could be an indicator of PCOS or polycystic ovarian syndrome. PCOS is generally a condition in which a woman's sex hormones, progesterone and estrogen, are way off, which often leads to the formation of cysts, though benign, in the ovaries. PCOS have a bearing on a horde of things such as the functioning of your heart, your menses, and most importantly, your fertility. There are several factors responsible for PCOS, such as the overproduction of the male sex hormone, androgen, genetic conditions, among others. But PCOS are among the important signs of infertility in women, so without losing time, get yourself checked. 6. You are losing excessive hair on a daily basis. Well, now hair loss is not a definite indicator of infertility in women. There are several environmental and internal factors that can be attributed to hair loss, and infertility being one of them. An unchecked thyroid could be a reason for hair thinning or hair loss, as are anemia, autoimmune diseases, and psoriasis. Again, an important cause of sudden shedding of hair or abnormal hair thinning is undiagnosed PCOS. Observe your body closely. If your hair loss issue is grave and sudden, fix an appointment with your gynecologist, for it is going to affect your chances of getting pregnant in the future. 7. Poor sex drive. Either you are having extremely painful sex or you have genuinely lost interest in sex. Both are conditions that need some mulling over. Stress, depression can often be the cause of a plummeted sex drive, and not to mention, there are a host of medical conditions contributing to the same, including infertility. If you are not going to have natural, healthy sex, you are not going to conceive your baby. Not going to have natural, healthy sex, you are not going to conceive your baby. So, don't leave it off as just another phase. A drastic drop in sex drive can never be normal, and be informed. You need to consult your doctor about this. There are superb treatments to get it back up and running. We sincerely hope you are not suffering from any of these conditions, and even if you are, there is no need to panic. All these conditions, while they are signs of infertility in women, can well be treated if you attend to them soon enough.
Welcome back, viewers. My guest is still Dr. Uduak Samuel. So before we went on the break, we were talking about sexually transmitted diseases, although we don't want to go into details of all the diseases, but it's established that sexually transmitted diseases, if not properly treated, can cause infertility. So we can go on that. Okay, let's move ahead to causes of infertility in women. Who are the most victim of this issue of infertility? What are the causes?
No, they have become victims because of ignorance.
Because of ignorance, obviously, yes.
As we said for men, some women are actually born without a complete reproductive system. Some women are born without the ovaries. Some are born without a womb.
Without a womb?
Yes, some are born without a womb. So these congenital abnormalities can result in infertility.
Oh, okay. Now I'm trying to, wrap around my head. Being born without a womb. Is it something you can discover while the girl is young or when she's little? Is it something you can find out, or it has to be when she's about to?
Yes, it's also boiled down to examination of the female child that is done at birth,
Okay.
and subsequently by the parents. Again, the parents, especially the mother, has a role to play. Now, there are a wide range of both congenital, or some of them actually chromosomal, that is genetic anomalies that can result in infertility. And those children that are born with this kind of problems do not grow normally. You understand? If the mother is very observant, you will observe that the child is not growing at the rate at which it's supposed to grow, or is lagging in some area. For instance, at a certain age, you expect the girl child to start growing a breast.
Okay.
After that, you expect the girl child to start developing hairs on the axilla and in some other areas, like the pubic region. But most of those children that are born with those anomalies do not develop those things at the time when they are supposed to develop. At a certain age, a girl child is supposed to start menstruating at about the age of 12 or 13. And if a girl child has not started menstruating at the age of 17, should be a cause for concern. And we advise the parents to take the child to the hospital for a proper medical examination to check if that child has a complete reproductive system, has ovaries, has the womb, has the vagina. You understand what I'm saying?
Okay.
So it's important for those children to be examined, because we've seen cases where nobody knows, the child leaves home, goes to higher institution, continue like that, not wanting people to know what her problem is, and become an adult, get married, and is not able to conceive, only for us to discover at the end or at a very late stage that she doesn't have a complete reproductive system. And again, some girls, some women that you see thinking that or looking like women are not actually women.
Okay.
Yes, they have chromosomal abnormalities that makes them look like women, while they're actually males. And what they have are male reproductive organs. So we will not have the time to go into all those, but it is important to note here that some girl children are born without a complete reproductive organs, and they'll find it difficult to get pregnant.
Okay, so mothers should actually watch out for mothers or fathers actually not keeping everybody out of the responsibility of taking care of the kids.
Yes, watch out how their children are growing. Are they attaining these milestones at the time when they were supposed to attend? Is your child started developing breast at the time when she's supposed to? So
when a lady's supposed to, just to help parents that are watching, at what age should a lady be expected to start developing her breasts? And
from about the age of 9, the child will start developing small breast buds, which will continue to grow.
Okay.
But if at the age of 15 or 14 your child has not developed anything, then it should be a cause for concern. You should take that child to the hospital to get a proper medical examination.
Okay, so this one now is more, it's natural,
Yes.
It's unfortunate
it's unfortunate that some women naturally.
But can it be blamed by any chance, or any studies that show that it could have something to do with the mother or the father? Or
in the past, there are some drugs that they used to give to the mothers of pregnant women, and that was found to result in children who has problems, especially a problem with their genital organs. Thankfully, those drugs are no longer in use. But it's also important for mothers, especially pregnant mothers, to note that the things they take, especially drugs, can affect their children, the children they are carrying in their womb, so that they are a bit more careful.
Yeah.
Not taking drugs, because the drug you take can damage the reproductive system of an unborn child. Yes.
Okay, so it's good to emphasize that for
Yes.
people watching that it's important that be careful what you take
Yes.
when you are pregnant to avoid some of...
I say this because there's a drug that they used to give pregnant people used to take before. They call it diethylstilbestrol. That used to cause a problem, but as I've said, it's no longer in use.
Okay, but you never know. You never know, so you just be careful with what you're taking. So other causes apart from the natural ones.
We have talked about infection in men. Infection in woman. In the woman is a very important factor.
Okay.
Because of, as I've said earlier, women are more liberal these days when it comes to sexual interaction. Children now start sexual intercourse earlier than before. And when they acquire infection earlier, because the reproductive system is still developing, they are prone to being damaged, sometimes permanently, by those organisms. Incidents of unwanted pregnancy and abortion. Abortion, if it is not done by people that have the knowledge or in a safe environment, can result in infertility.
Okay, badly done abortion.
Yes, badly done abortion, what we call unsafe abortion.
Unsafe abortion.
Yes, and you know abortion is illegal in Nigeria. That drives it on the ground. It's done in dark places, in chemists, by people who are not qualified, using instruments that are not sterile. Yes.
People taking all manner of concoction. I hear they take lots of concoction too.
Yes, those things can result in damage to the reproductive organs and cause infertility. It could also be caused by hormonal issues, hormonal imbalance in the child. The woman's cycle, monthly cycle, is controlled by an interplay or a very interplay of hormones. And when these hormones are not released in the quantities in which they are supposed to release, they cause a problem in the woman's cycle. Some hormonal anomalies or some hormone abnormalities can result in the woman not ovulating. Now, ovulating means release of egg. A woman has to release an egg that we mix with the husband's sperm to form a child. So if the woman is not releasing the eggs, she can't be pregnant.
So if you're not releasing egg, you obviously not be seeing your monthly menstrual cycle, or does it still?
Not necessarily.
Not necessarily.
So.
Okay.
We have what we call anovulatory cycles. You're seeing your cycles, but you're not releasing eggs. You're not ovulating.
Okay.
But let me also say here that the fact that you're seeing your monthly cycle regularly is a pointer to the fact that you are probably ovulating.
Okay.
Are you following me?
Yes, following you.
That you see your cycle or your monthly menses on a regular basis also means that you're most likely ovulating. On the contrary, that you're not seeing your monthly cycle regularly could mean that you are not ovulating. There are women who don't see their cycles every month. There are some women who see their menses like 3 times in a year. They see it in January, see another one in July, and see another one in November, and that's the end. So those kind of women may also have problems getting pregnant. Some of these women include those that discharge milk from their breasts when they are not breastfeeding. I'm sure you've heard people
yes.
Because the hormone, the same hormone that makes them to produce milk from their breast, can also suppress the ovulation.
So if you're having breast milk before, and you're obviously not pregnant, but you're having breast milk, it's something to worry about and go and see.
There are many reasons why a woman will produce milk.
Okay.
And while she's not pregnant. But if a woman is producing milk from her breast and she's not breastfeeding, and she's also having problem getting pregnant, you should seek medical advice because the two might be related.
Oh, right. Okay, let me ask about, I think I hear something constantly these days, blocked tubes. What are blocked tubes? Because it's one of the things when a woman cannot take in and they say you have blocked tubes.
Now, the reproductive system, organs of a woman includes a womb, that is the uterus, and 2 tubes that are attached to the ends that are connected to the ovary somehow. When the sperm is deposited in the vagina, it swims up into the woman's womb through the tubes, and when the egg is released from the woman, it's captured by the tube, so it's transported through the tube
to join to meet
the two of them will meet somewhere in the tube. Fertilization means they will fuse, baby will be formed, and that baby will be transported through the tubes back to the womb for implantation. That's
what you call the uterus.
Yes. Now, you can see how important the tube is, because the egg is transmitted through it, the sperm transported through it, fertilization occurs inside it. So you need a tube that is not just open, but is functional, because it is possible for a tube to be open, and yet it's not functioning. So when the tube is blocked, there is no way the sperm that is coming from down and the egg that is coming from can meet.
Right.
And the tube is is a very tiny structure that can easily be damaged. And we have talked about infection. The way in which infection causes infertility is to cause tumoral damage.
Right. So not properly treated
infection,
sexually transmitted infections will
not just sexually transmitted infection acquired through instrumentation, that is like the abortion that we talked about, or in the process of delivery. You've heard or you've seen a woman who gets pregnant and deliver one child, and after that one child he's not able to conceive again. He may have acquired an infection in the process of that delivery.
Especially deliveries that are not done properly.
Yes, deliveries that are done at home or in very unhygienic places. The woman can acquire infection, and that infection can block her tube and prevent her from getting pregnant subsequently.
Wow, so that's very serious. So that's the general concept of when they say a woman has blocked tube. Very important. So what she does immediately, she finds out, okay, we'll talk about the treatment shortly. One other thing I wanted to just ask about is fibroid. Can it be responsible for infertility? A woman who has gotten it or has been removed or has it, does it stop her from taking in?
Yes. Thank you for bringing up the issue of fibroid, because there's a lot of misconception around fibroids and fertility. The relationship between fibroid and infertility or fertility is not a direct cause and effect relationship. It is not like if you don't have fibroid, you can get pregnant. If you have fibroid, you cannot get pregnant. You understand what I'm saying? Because many women have fibroids, they get pregnant with it, they carry the pregnancy to 9 months and they deliver, even with fibroids. And there are others who have smaller fibroids and they can't take in. In a very small proportion or percentage of women, fibroid can cause infertility, especially if you have, depending on the location of the fibroid. If I have fibroids that blocks the 2 tubes, it can result in infertility. If you have a fibroid that is located within the cavity of the womb, it can can prevent implantation of the baby. But as I said, it's in a very small proportion. Yes.
Okay, when we come back, we'll discuss the treatments and how to, handle some of these fibroid issues. So we'll be right back. Welcome back, viewers. Before we went on the break, we were discussing the causes of infertility in women, and my guest is still Dr. Uduak Samuel. But let me just ask one more question before we go into treatment. Lifestyle, does it affect or does it have anything to do with infertility? Lifestyle change over the years?
Yes, the lifestyle has a lot to do with infertility.
Okay.
Take smoking, for instance. Women who smoke are less fertile than
women who smoke.
Yes, are less
fertile.
Yes, are less fertile. In fact, some people say that smoking literally burns the ovary.
Okay.
It's like the fire itself burns the ovary. So women who smoke are less fertile. They tend to suffer. They tend to achieve menopause early. They tend to have ovarian failure early, and the ovary is where the eggs are produced. So obesity.
Okay.
People that are obese are less fertile too. Yes. And people that are obese tend to have more hormonal issues.
Okay.
So we encourage people to be active. Exercise to maintain a moderate weight. So that they're not obese. Alcohol, of course. Alcohol can result in too much of alcohol, excessive alcohol can cause infertility. It's been associated with erectile issues.
That's for the men now.
For the men
so
now.
The smoking does also affect men as well?
Yes, it does.
And obesity.
Yes, it does. It's toxic to both the men and the female. And don't forget that the cells that will eventually become a child are so delicate that they get easily damaged by chemicals, toxins from those things that we do socially, drugs, marijuana, and all of that.
Things that we're putting in our body.
Yes, but because we've talked about sexual erectile dysfunction, I just want us to remember those who use lubricants.
Okay.
During sexual interaction, some women feel they are dry, or some men feel their wives or couple are dry, so they apply lubricants. They use all manner of oil, all manner of jellies. That on its own too can be responsible for the couple's inability to get pregnant, because those things are also toxic to the sperm cells. Yes. Okay. So it's important to raise that issue here.
Okay. Now, what of the coital habits?
That's exactly what we are talking about.
Okay.
Yes, because from my experience, I've seen couples who come to the hospital to say that my husband does not last long. That is to say, my husband does not achieve erection or cannot sustain erection. And can that be a cause of infertility? Yes. But suffice it to say that if a man is able to achieve an erection that is long enough to enable him deposit the sperm at the proper place in the body of the woman, it should not be a problem. It shouldn't cause a problem. It's a problem where the man is not able to deposit the sperm. That is where it's only a problem. So it's not the duration of coitus that is important. So long as the man is able to achieve enough erection that will enable him deposit the sperm in the proper place in the body of the woman, pregnancy can occur.
So that should not be a cause.
So it should not be a problem.
Of what? Okay, let's talk about treatment because of our time. Let's start with when a man is diagnosed with infertility, a problem of infertility. But you know, some of the times when you do the diagnosis for a man and you say the man is infertile, I know there are things that has to do with whether the sperm is directional or I don't know if you just walk us through that.
I know the diagnosis of diagnosing the cause of infertility should actually be made in the hospital, and through the use of laboratory tests or radiological investigations. It's easier for the man, because in most cases what you need to do is ask the man to submit a sperm sample.
Okay.
But even before then, before he gets to submit his sperm sample, the man needs to be examined. The man needs to go to the hospital. The doctor will take a history, and in the history he will ask questions that are relating to those causes that I've mentioned before. Did the child have mum, or did he have mum in childhood? He's fallen, has tried an object, he has pain in his testes, like what we call testicular torsion. It's a condition where the testes twists, and the blood supply to the testes is compromised. That can cause damage. What kind of work does he do? Does he work in an environment that is very too hot? Does he drive long vehicles? Is he exposed to radiation? Does he work in places that have high concentration of toxic radiations that can damage the system? The doctor will find that out. Is he diabetic? Does he smoke? Does he take
diabetes
alcohol?
Polycontrolled diabetes can result in that.
Now, after that, he will examine the man. Does he have the complete, or the male physical structure? Men have receding hairlines and all of that. There's a male pattern of hair distribution. So does he have the normal male physique? He will examine his scrotum. Does he have 2 testes in the sacs where they are supposed to be? Does he have undescended testes? And there's a condition called varicocele. It has to do with venous veins that are in the testes, and when they're abnormal, they can become swollen. Blood will stay there. Cause temperature changes, which can cause damage.
So these are all the things
that the doctor will have to do. Then after that, we now order for a sperm analysis. Now, it's important to say here that the quality of the sperm does not actually depend on this count alone, because it is very common for you to hear they has low sperm count.
That's the general thing people say. Oh, I have low sperm count. They just think that's all.
The sperm count can be normal, but what about the movement of the sperm? What about the physical structure
of the sperm?
So all of that will be taken into consideration to say, yes, this sperm is capable of causing pregnancy. That is for the man. For the woman too, the woman needs to go to the hospital. The doctor will examine the woman from head to toe. Find out, is it really a woman? Where there is doubt, genetic tests can be done to establish whether the person is really, truly a woman. We'll check, does he have a complete reproductive organs? And the next thing will be, does she ovulate? And there are tests that can be done in the hospital. But thankfully, there are over-the-counter test kits that has been developed that the woman can actually buy on her own and check. They call it ovulation test kits to check if she's actually ovulating. In the hospital, more reliable, more complex things can be done. And it is after doing all of that the doctor may find a cause for the problem. But as I've told you, there's a small percentage, like 10%, that is called unexplained infertility. You've done all the tests, and you've done all the tests that you can't do, because in this part of the world we are still limited in terms of technology by what we can do. You understand? So you can use the available technologies here to do, and you can't find something, and the same woman goes somewhere else where more sophisticated advanced technology available, and they can find something.
Okay, so it's actually, well, even with the advanced, there's also that little percentage that everything is okay and there's no pregnancy, there's no child. Okay, so now let's go to treatment. When you found out now what exactly the cause is, what kind of treatments do they go, and how complex or expensive?
Now, treatment depends on the cause. The first aim of treatment will be to remove the cause, if you find anyone. For the man, take for instance, if the man has varicocele,
okay,
he may require a small surgery to correct it, and his fertility is back.
Okay.
If the man has undescended testes, depending on whether it is 1 or 2, might be treated. If the man has hormonal issues that will make his sperm quality not adequate, it can be corrected. So the treatment will depend on what the cause is. So also for the woman. In case of the woman, whatever cause that is found can be removed. If it is fibroid, even though I wouldn't want to talk about fibroid first, if it's fibroid can be removed. If the woman is not ovulating, there are drugs that she can take to increase her chances of ovulating. But let us also say here that a lot of women have fallen victims of all manner of people who claim they can give them drugs to take.
I was even going to ask.
They call it fertility drugs.
Yes, I was even going to ask of it. You see them, it's been advertised on TV, you drink it, and in 2 weeks you take it, and 1 week you are
fertility drugs.
Very pregnant.
I agree. There are drugs that can be given that can help a woman, assist a woman, improve her fertility. For instance, ovulation induction drugs that you can take to help enable you ovulate. But it's important for you to consult an expert before you take those drugs, because people have given people all manner of things to take and they waste their time. They keep taking, it's not working, and they take it for years and it's not working. They now decide to seek experts, medical attention at the point, and they have lost time. So as I said, treatment will depend on the cause. Now, it is important to note that the younger a woman is, the better her chances of achieving natural conception. In fact, even with the use of assisted reproductive technology, your chances are still better when you're young. And that is why we encourage women to seek medical attention early. It is usually very painful to see people who got married. Women don't marry early these days. People who got married, a woman is 30, and she's been married for 8 years, 10 years, and she's not able to get pregnant. And in those 8 years, 10 years, she has gone to all manner of places,
taking all manner of things,
religious centers, taking herbal medicine, and at the end, it doesn't help. And she shows up at the age of 40 or 30. Her chances then has really gone down if we compare it to when she got married. So we encourage couples, you get married, you try, after 1 year, no pregnancy, seek medical advice. Well,
we've really gone out of time. But there's a question, that's been in my heart to ask: how do men receive the story or the information that they can't? Most of the time women are the ones who are in the forefront of this. Okay, the couple can't have children, then the wife is the one that has to go and check that she's all right. But in your experience, how has it been for the men when you tell them, or you mention to them that, look, you're the one responsible for this problem? Is it well received?
No, men will always be men. Men will always be men. Men believe they don't have a problem. It's a woman's problem. But if you show them what the problem is, if you make them understand what the issue is, if you have clinical evidence to show them, say this is what we have found, from our history, from our examination, from the test that we have done, this is the result, and we think the problem is you, they will take it.
They have to take it and then start working.
They'll take it. So we start finding solution. First of all, you must accept you have a problem before you can even start finding a solution. I know some men that will say, no, I don't believe your test, and they go away. And the problem continues. The problem remains.
All right. Now, when a couple want to get married, is it advisable for them to, before they get married, do kind of a check to be sure that everything is okay before they go into the marriage? Or is when they find out that there's problem, then everybody starts running? Is it advisable, you know, with your years of experience?
Well, I don't understand how they can do that.
Okay. I mean, come and meet me. Say, come to the doctor and check. Both of us want to just be sure.
No, opinion differs.
Okay.
When it comes to this, I don't believe that. I believe that when people get married and start having children, because you can do the tests that you do, and it's okay, it's normal. The man has done his own test, it's normal. The woman has done his own test, it's normal. But when they come together, there are other problems of incompatibility.
Okay.
Yes, problem of incompatibility. Okay. So yes, there are situations, there are immune problems between the man and the woman that can result in infertility.
Okay, well, just shed a little light on that, because now both of you have checked and you're fine, and
no, you're fine in your own corner. This woman is fine in your own corner. But when the two of you interact, there are problems of, I don't know how best to put it, problem of incompatibility.
Okay.
Immunological issues. Immune problem. Your system or does not accept mine, even at the level of the cells, even at molecular levels.
Okay.
Do you understand?
Yeah.
So that can result in infertility. So if you do your own in your own corner, you're okay, you do, but the two of you are not compatible, so to say. The problem is still there.
It's still there. Okay, one more question before we round up. Now, the church. How can the church help, especially with this issue of, you know, from the beginning of the discussion, we established that the issue of infertility is normally 30% male, 30% female, 30% both, couple, and then 10% somewhere that, is not explainable. How can the church help in enlightening people more? Because even in the churches, you find out that somehow the bulk of the blame is kind of put on one side of the, I don't know if it's I think it's a cultural thing more, and then it's gotten into the church. How can the church help, this kind of issues in marriage?
I believe that the role of the church is enormous. It goes beyond enlightening people about who is at fault and who is not at fault. I believe the role of the church actually starts from preaching morality, morals, so that the girl child does not engage in dangerous sexual activities. Preaching morality, so that the girl child will keep herself, grow up into a responsible woman, get married at the right age, and start having children without engaging in
multiple
dangerous sexual behaviors that will result in unwanted pregnancies that will be aborted in environments that can predispose her to infection. So the church has a role to preach, to teach to teach morals. Number two, the church also has a role to dispel some of these myths about spiritual components or spiritual causes of infertility. I agree with you. The Bible says we should not be ignorant of the devices of the enemy. While we acknowledge the fact that the enemy can come in different ways to scatter the family, to cause problem, but many of the problems that we attribute to spiritual causes are actually medical. So it is the role of the church also, while praying for the couple to get pregnant, to also encourage them to seek medical advice early enough.
Okay.
Do you understand? Because we've seen many cases where people go to church, go to prayers, go to even those that have obvious medical problem. Take for instance, people have fibroids, and instead of seeking medical solutions to their fibroids, they keep going to church for prayers.
When the solution could have come in easily.
So on that aspect or part to the church has a role to play. Then, of course, the church can also help in enlightening people that there are scientific solutions to their problem. Now, there is this issue about assisted reproductive technology, what we call IVF. IVF. Many people won't accept it.
They think it's playing God.
Yes, it's playing God. But it's not playing God.
Yes,
you understand?
It's wisdom from God. If church
leaders are educated enough to know that it is God that has given people knowledge to do these things, and God has enabled people to do that for the benefit of mankind, then people will appreciate it more. People will believe their pastors more.
Of course.
If the pastor say this thing is good, it's not dangerous, you are not, they will believe it. So the church also has, and with the development of science and technology in this era in which it is virtually possible for every woman, almost every woman, to get a child, or every couple to get a child. Through the use of assisted reproductive technology. But people will attach
so much,
cultural, spiritual connotations to it. And
anyway, thank you very much. It's been a wonderful discussion for the past 45 minutes. Thank you very much for coming on the program, and it's good to have you. And we hope to see you back some other time.
It's my pleasure.
All right. Thank you very much. Thank you very much for staying with us. I hope you have learned one or two things on infertility. Don't forget that you can sponsor or reach us via the contacts now showing on your screen. My name is Angela Mweze. I'll see you soon. God bless you.